Welcome to the Skincare Academy's Acne and Aging to Glow podcast. I am your host, Hayley Barnes, one of Australia's leading acne naturopaths and educators. I went from having acne myself for over 10 years to studying naturopathic medicine and not only treating the root cause of my acne, but hundreds of women's acne in clinical practice also. Now I teach skin health professionals internationally how to treat the root cause of their clients' acne internally. Acne is a sign that the body needs internal support, and until the individual's internal cause of acne has been addressed, you cannot treat acne. No amount of skincare and treatments will treat the internal root cause of your client's acne. On this podcast, you can expect to learn naturopathic acne treatments, internal skin support, evidence-based treatment plans, the latest acne research, holistic skin fundamentals, and most importantly, how to become the leading acne specialist. I will also introduce you to the most influential industry professionals that I know along the way. Did you know the first body system to address when treating acne internally is always the gut? It is simple. If your client has acne, they have gut issues that need to be addressed before you and your acne client will see results. Which is why I have created a free masterclass called Treat Acne Through the Gut. And in 45 minutes, I teach skin professionals just like yourself in 3 simple steps how to confidently identify and explain the root causes of acne in the gut, using the exact naturopathic case-taking questions that I use in clinic, as well as my signature acne face map explained. Why digestion in the stomach, absorption in the small intestine, and elimination in the large intestine needs to be addressed, and addressed systematically and specific to the individual acne client. Now, a big tip is it's not all about the microbiome here. The exact nutrients, foods, and supplements needed to treat acne through the gut. To access this free training, click the link in the show notes, and I cannot wait to see you inside the Treat Acne Through the Gut Masterclass.
Haley, thank you so much for joining me today. Your path is so unique. You not only work with patients directly, but you train health professionals, you train naturopaths that then work with acne patients. So I feel like your impact is even greater. Your profession is so unique, and I'm so curious to know more about it. And I know that you have experienced acne yourself, and now you have perfectly clear skin. So I'm really curious for your tips, how your journey has been. And if you could tell us a little bit more about your acne journey and also your professional journey, what brought you to become a business owner of Skincare Academy, training health professionals now.
Thank you very much, Angelina, for having me here, and hello to everybody listening. I'm so excited to be here because it seems like a whole lifetime ago that I was on my acne journey, but I do relive that journey with the clients that I treat and the therapists and the professionals that I help educate to treat their clients' acne. But I'll start with my personal journey. So I had acne ever since I got my period at 13 years old. I was the first female to kind of reach puberty and have those hormones, and really suffered with acne quite severely, being bullied and having to move schools and things like that as well. And living in the country of South Australia, it was a very remote regional area. We didn't have access to anything. We hardly had access to doctors. So we were quite limited in regards to, I never knew what a naturopath was. We were even limited to what fresh fruit and vegetables we could get in and things like that. So I tried everything, like every person who has acne, but I think I take the cake because I actually tried everything. And later on in my teenage years, that led to things like, in my late teens, led to things like the pill, antibiotics, topically and internally, and then taking things like Roaccutane, isotretinoin, and changing my diet as well, and in combination with extreme pharmaceutical medication to help treat my acne. And nothing really worked. It would work for a few months and then it would just get worse, or it would work for a few months and get better and then it would just get worse again. So very big roller coaster that a lot of people go on, and I can really walk that path with my clients and with the therapist that I train, because I was on that path as well. But what really got me concerned and really started the spark of me wanting to become a naturopath was going on Roaccutane and still having acne. I had actually already started studying naturopathy when I went on Roaccutane, because I was doing all of the diet and taking dairy out and things like that, and that was helping massively. But I never had anybody sit me down and kind of say, let's mind map your whole life and what you do, and let's work out the root cause of your acne, and I'll hold your hand and we'll walk together to treat the cause. Until I had a naturopath who did that for me, and it made me ever so fierce, and a spark ignited me to walk that path, and not only walk that path but change the whole industry in regards to how dermatologists, doctors, the general public see acne and treat acne. And then 8 years down the track of tertiary education at university, studying my Bachelor of Health Science, Naturopathy, and my Bachelor of Clinical Science, and I majored in complementary medicine and naturopathic studies. So I was a double qualified naturopath, and I always loved focusing in on aesthetics and skin, and nobody was really focusing on that. Everyone was doing fertility or menopause, and I was like, I really want to do skin. And then, I launched my own online clinic. So I was taking acne clients online. And then I started to get other skin health professionals, such as dermal nurses, registered nurses, skin therapists, even beauty therapists, other naturopaths, ask me how I was getting all these results and how my clients were coming to me and how it was all happening. And then I decided to alter my direction of my business and really work with those skin health professionals. So that's where I am now, teaching skin health professionals my signature course, which is Advanced Acne to Glow. And you can't get all of that information in a one-on-one appointment. And that's why that's why I said yes to you today, because I'm so passionate about education, and really, we learn something new every day. And really, at the end of the day, the naturopath isn't going to treat you and cure you and heal you. You really need to know your body and communicate to the naturopath for you to work together. So, yeah.
Absolutely. There's no one more passionate about delivering that acne knowledge and changing the acne landscape than people that have lived through acne. So I totally understand your journey. I'm still going through it. I'm still kind of in the middle of mine. But you're such a big inspiration also for me as a patient. I feel like, so you mentioned that you've gone through all the possible treatments, down to isotretinoin. And when people first encounter acne, they tend to seek for that magical pill. They think that they will find that magic wand that will turn their skin around overnight. Especially in the case of Accutane or Roaccutane as a tretinoin, the efficacy is quite up there. Even dermatologists, they put a lot of hope in that treatment. But you've said that it didn't quite work out for you. What do you think was missing in that traditional dermatology treatment in the traditional approach that we have to treating?
Great question. And what was missing was that step-by-step, holistic, grassroots, naturopathic foundation, naturopathic medicine and principles of practice of treating the body like a whole. Dermatologists treat skin. I'm an aesthetic naturopath, but I treat the whole body. I cannot treat someone's whole body, their hormones, their gut, their liver, lymphatic system, and nervous system. I can't treat their acne. They can't treat their acne unless we look at those 5 massive bodily systems and really address them all individually, because our body connects, and science has now shown that. In, for example, we have the gut skin microbiome connection with all those microbes. We have the hypothalamus pituitary adrenal axis. So there's all these different interrelated connections. So we really need to address that holistically. And I think that's what that biomedical model is missing, because they're not taught holistic medicine and they don't have foundations in pharmacokinetics, pharmacodynamics, how herbal medicine works, and nutritional medicine. So we can't blame practitioners or therapists or health professionals that don't have that education or knowledge, but I do. So that's why I need to be out there, and other naturopaths need to learn, how we can. I have the step-by-step pathway that I've trialed and tested over, 8 years. And that's why we really need to focus on naturopathic ways of healing. And that's where where naturopathic healing really takes the cake in any type of treatment method in regards to acne. It's so clear for me to see that, but obviously it's my work explaining that to the public and to the community, and in how that works, because it's not, like you said, Angelina, a quick fix, and it's not this pharmaceutical Roaccutane will treat this. Herbal medicine works very differently in the fact that we could both have acne, and our acne could be severely triggered by an excess in cortisol. But what triggers that excess in cortisol? I might get stressed from public speaking, and you might get stressed from being by yourself in your house. That, herbal medicine works differently in the fact it takes into consideration the individual person and what's going on for them, and we treat accordingly.
Right, that makes sense. So if someone is, on benzoyl peroxide, retinoids, or isotretinoin, and has notices that that treatment doesn't quite deliver the effect that they wish for, what do you think their first step should be in order to initiate that path of more comprehensive, more holistic care? Should they first go through a panel of diagnostic tests? Because you've said that every case is unique. So what the first step should be, and how perhaps this ties to the individual nature of each case. Perhaps do you prescribe some diagnostics in order to qualify each case, to see what kind of root cause for each person is?
In Advanced Acne to Glow, I teach my therapists clinical case taking questions, so they're able to have an initial appointment and ask those questions. For example, how many bowel motions are you having a day? Do you have zinc lines on your nails? Are you sleeping at night? Are you dreaming? If you're dreaming, then you're going into the REM sleep. If you're not, do you remember your dreams? All these types of weird and kooky questions that actually make sense to naturopaths and how we interpret them as an individual. So I would say find a clinical naturopath who you resonate with and who you trust, and who has bachelor level university grade qualifications and specializes in acne. Any Jenny down the road can call herself a naturopath here in Australia. It's not a heavily regulated profession. So as the consumer, you need to take initiative and really look at their qualifications and really find the right therapist that can empower you, for you to understand what the root cause of your acne is. Now, in saying that, I I know, because I'm very good at this now, I can look at people's case notes and I can take appointments with them and I can work out what their root cause of their acne is. But for you yourself, I always say start with the gut and then go to hormones and then go to liver and then go to nervous system and then go to lymphatic. So schedule out, and that's the step-by-step that I teach in Advanced Acne to Glow. And if you do it that way, it'll systematically work beautifully because, if you've got excess estrogen, if you've got excess hormones and dysregulation, we don't want to stimulate, your gut or your hormones, and then your liver's not being able to effectively metabolize those hormones. So it's going to end up in a bit more of a chaos. And, that's why sometimes acne does get worse before it gets better, because there is a purging situation that happens. But if you do it in the right framework, then you will see results over a longer period of time, though. It's never a quick fix. And just like, that saying, nothing amazing happens overnight, it is hard work and you have to be committed to yourself. But if you do walk that path and you do treat the cause of your acne, I don't want to put labels on it, but I know that you are going to set your fertility journey up beautifully. You're going to be able to have more energy. You're going to be able to have the whites in your eyes and you're going to sleep better, have better relationships, feel better within yourself. So it's not just an external fix. It's the best and the biggest self-development course you can ever take, individualized to you.
Yes, absolutely. And also, I feel like acne is often the first visible sign that something is not quite right in the body. So by working on our underlying factors on the causes of acne, we can prevent other more serious conditions from developing, like insulin resistance and diabetes and obesity, maybe even cancers, and, as you said, fertility issues. So it's just a great motivator to kind of take responsibility over your life and start a healthier lifestyle.
Yeah, I mean, I don't know about cancers and things like that, but if you look at the body in regards to inflammation, really simply, acne isn't a skin condition. It's an internal health crisis, and, smack bang, put it on your face. So then you can really wake up to yourself and see what you need to do in regards to what work, our bodies are so smart. And that's what makes me super fascinated, Angelina, every day, is to go, even I might break out now and then. Okay, what is my body telling me? Thank you for telling me that. Okay, it's here. That food really didn't digest well with me. I need to eliminate that from my diet and work on eating something else. Or I'm really getting congestion under my neck here. Okay, my lymphatic system is struggling. So we can have that communication and connection with our skin and our body, as opposed to, oh my God, another pimple. Oh, it's just so many. I don't even know where to look because there's so many to even track them, and as soon as you get 3 or 4 pimples, it's just like you think they're everywhere. So I think just trying to change the mindset and really trying to decrease some of that excess cortisol and stress of that vicious cycle between having acne, being stressed you've got having acne, and being more stressed that you can't find the cause of your acne, which leads to more acne,
Yes, yes, that sounds very familiar. Yes, I want to underline, Haley, what you've said a couple of minutes ago, that guidance that a professional can provide you, a naturopath, it's really important to find that professional that you find reputable, that knows the acne landscape through and through, that could guide you, from analyzing your gut to analyzing your liver to analyzing your lymphatic system, because acne is so complex, as you've said, and if you are just alone in your bubble, it's so easy to get overwhelmed and confused, and it's so crucial to find that professional to guide you. But you've also said that, a professional is there to support you, but ultimately the work is on you. You go back home, and ultimately it's your choice whether to pick a donut or a salad. Can you maybe give us three lifestyle habits that each one of us, no matter our personalized case, can implement from tomorrow to impact our skin in a better way? You know, the three kind of biggest tips, easy to implement, that each one of us can be motivated to start right from today.
Go to bed before 10 p.m. Your hormones reset and you have this beautiful recharging, revitalizing, wound healing. You know, even if your body's already trying to heal acne, that all happens at night. And obviously, cleansing your skin, having the double cleansing of your skin with oil, a normal cleanser first and an oil cleanser second, morning and night, because you want to do it in the morning because you want to help wash off everything that was digested and absorbed and things like that on your external layer of your skin during the night. But that 10 p.m. Cortisol peak that happens and the hormones tend to go wild can be like a bit of a rat race the next day, and I've even fallen victim to that one. So we're all humans. But I would say that would be the first one. And then I would say gut health. Really have a little diary, and, you know, you don't have to get fanatical about it, but just see how many bowel motions you're doing a day. Look up the Bristol stool chart. See if it's a healthy motion. See if there's any undigested food in there, because you can eat an organic, clean diet till the cows come home. But if you're pooping out undigested food, the villi is not tight, and so you have intestinal permeability, leaky gut, and so you're wasting all of that nutrients and that you're eating. So, and that can be quite an exhaustive process in itself, trying to eat all the good things and being frustrated that you're eating good food and it's not helping. So that would be number two, you know, getting to know your body and your health emotions and what you thrive on, you know, in regards to your bowel motions. And number three would be making sure you are eating foods high in prebiotics, and you're pairing that meal with a protein for breakfast, lunch, and dinner. And then making sure you're supplementing with high strength probiotics that are clinically proven to help treat and reduce acne. There's certain strains now that have been shown to reduce the formation of acne, and just taking a probiotic from the pharmacy isn't going to cut it. I mean, it's not bad, but you really need to find those high strength practitioner only supplements. Like when you go to a pharmacist, they can prescribe things at a higher dose. A naturopath can prescribe probiotics at a higher dose. And take them daily. Take them daily. So I would say those three things would be what I would focus on to get going.
Right. Yes, that makes sense. You know, gut health and, you know, sleep that then manages your cortisol levels and your stress. You know, these are really the fundamental aspects. So you mentioned that you prescribe supplements in your practice. So that's a great segue into my next question. What is your arsenal of treatments? Do you lean towards treatments that dermatologists prescribe? Do you prescribe maybe more herbal medicine? And what else do you prescribe? You mentioned supplements. So what kind of treatments and procedures do you usually prescribe and recommend other practitioners do?
Yes. So that is different for every single individual, and I'm very passionate about that. I wouldn't prescribe zinc to someone because I know zinc's good for skin and wound healing and things like that. If they already have enough zinc in their diet and, you know, I test that and I see that, I wouldn't prescribe zinc. So as much as everyone, you know, says, oh, you need to take this and that, I kind of don't do that. And I look at the individual. I can tell whether they're zinc deficient from looking at their nails and what they've told me. And then I can take it another step further and I can run blood tests and functional pathology. So I use a formulation of case taking and looking at the client as an individual to what supplements or treatments I use. And if I need to use pathology to solidify that and really track dosage, then I will, because I don't want to put people on supplements for the rest of their life either.
Mm-hmm.
So it's important to always give a time frame. As a clinical acne naturopath, I have a massive array of treatments that I have access to, and high dosing herbal medicines and supplements isn't always going to treat acne either. So it's really case by case, but I have access to all practitioner only supplements here in Australia, and I can send them overseas. I have clients in Canada, and I had a client in Italy actually before. And it just really depends. So it's a combination between micronutrients, macronutrients, herbal medicines, in all different formulations, customized tinctures, customized compounds, so compounded powders specific to the person. Prescriptions like meditation, sometimes that's on my prescription for people to engage in whatever way that they like to meditate. That might not be sitting down and cross-legged and, following along. Their meditation might be journaling or painting. So it's really working with the individual and working out what works for them in regards to what treatments I offer. So I'm complete 360 from what dermatologists and doctors offer in regards to their treatments. And yeah, I'm very confident in the treatments that I offer, and I feel good giving those treatments to my clients because I know they have minimal to no side effects. And I know that they're not only helping the client's acne, but they're helping support the entire body of that person. You cannot treat acne with skincare, facials, and treatments alone. It is as simple as that. You need to treat the cause of acne holistically to internally treat acne long term. You see, a lot of therapists I have spoken to have even thought about going back to uni to study nutrition or naturopathy, but the thought of paying over $70,000 in tuition fees and studying full time for 4 years is just too much for them to manage with their current workloads. I have been helping skin therapists and professionals just like yourself learn how to treat the cause of acne with nutrition, lifestyle modifications, herbal medicine, with great success. I have over 13 years experience in the field of naturopathic medicine, and this is why I have created my signature step-by-step curriculum teaching therapists how to understand naturopathic clinical case taking skills and how to treat the internal cause of acne. I love seeing therapists step into their role of a confident, holistic, internal, external acne specialist. My therapists, who are Advanced Acne to Glow partner clinics, naturally show up online more confidently because they are able to talk the talk and also walk the walk. This is absolutely key in this industry for your business to be successful and for you to move forward in this field of treating acne holistically. You will learn how to heal your client's gut, balance their hormones, support liver detoxification processes, nourish their nervous system, provide lymphatic support, all using food as medicine and key naturopathic treatment modalities. The level of holistic treatment you will be able to provide to your clients will naturally attract higher quality and more aligned clientele to you, as you will be positioned as the holistic acne expert. This means more income, more long-term results for your clients, more loyal clients, and more confidence in your ability to treat the cause of acne, internally and externally. This is what I teach inside Advanced Acne to Glow, my step-by-step course teaching skin professionals how to treat the cause of acne internally in their skin clinics. No need to refer to a nutritionist, doctor, dermatologist anymore, leaving money and long-term results on the table. You can and you will achieve these results for your clients naturally yourself. Click the link in my show notes or in my Instagram bio to join Advanced Acne to Glow. If you would like to become the confident, holistic acne expert and help hundreds of clients achieve their dream skin and health goals.
Right. And how long does it usually take for an average client of yours to start seeing first results and to get that first boost of motivation? You've said that acne is a long journey, so and it's it's not reasonable to expect results overnight. But how long does it take on average to start seeing those first results and get motivated and self-confident again?
The golden question and the loaded question that I get all the time. Depends if someone's been on the oral contraceptive pill for 14 years and they've just gone off of it. Their journey to seeing clear skin results might be longer than someone who's just started forming acne on their face or their body. I like to say 3 months, a commitment for 3 months to really start seeing. Depends on the person, but most clients in a month will see a decrease in inflammation. And then we're going to, wound healing and prevention of future breakouts. And there's a lot of things that are happening underneath the surface as well. So 3 months.
Right. Yes. And I mean, that's comparable to protocol treatments. When we look at clinical trials, usually for new acne treatments, they run usually for 3 months. So that's kind of an average span of an acne treatment.
Mm-hmm. But my one-on-one clients, I only have 6 spaces every 6 months for one-on-one clients. The rest of the work that I do is educating in a teaching role for other therapists. I take clients for 6 months. So in that 6 months process, that's a sweet spot I find to really work with clients and walk that path with them.
Right. I mean, to someone who has just gotten acne, 3 months or 6 months might seem like a lifetime. That's time that they feel like they aren't their fullest self. They feel they don't feel confident in their professional life and their personal life. But as someone who has had acne for over 10 years, I can safely say that commitment, that investment in your skin of 6 months is nothing compared to seeing your skin getting worse and worse over a decade. So that 6 months is really manageable. So
yeah, I was just going to say, I remember when I had acne, everyone's like, you'll grow out of it or that. And I was just like, oh, this is just so annoying. You don't grow out of it. And it can be aggravated when you become pregnant, and then it can pop up in menopause as well. Mature age clients that are going through menopause. So if you can do the work now, do it.
Yes, I fully agree. I feel like if we let those underlying causes run their course, I mean, this is not proven or anything. It's just my impression that we might aggravate the situation, that if we just let them be, they might get even worse over time if we don't deal with them right away.
Yes, that's exactly right.
So, Haley, let me ask you a controversial question. So, I follow you on Instagram. That's how I found you. And you, you're very outspoken when it comes to gold standard treatments for acne, like benzoyl peroxide. And you say out loud things that I would love to say, but you say that so confidently. So I know that you're not fully on board with benzoyl peroxide. And why is that? Can you elaborate on your position towards benzoyl peroxide?
Acne is not a skin condition. Acne is a health challenge. Benzoyl peroxide strips the top layer of the skin. It doesn't treat acne. It can aggravate acne, disrupt the acid mantle, and cause more inflammation and excess sebum because the body's trying to compensate. And the body's amazing. It's smart. It's trying to help. So you're fighting an endless battle with benzoyl peroxide there. And I remember my proactive days, and I would use that till the cows come home. All the towels and the sheets would be bleached. And yeah, I just look back and I didn't know what I know now. So I say this with love, and I just say, if I knew what I knew now, I would have gone internal quicker and stopped the damage. Because you think acne, like I have acne scarring, and I created a course, Advanced Acne Scarring to Glow. So let's just fast forward it. You're using benzoyl peroxide, there's going to be potentially acne scarring there. You're not doing any benefit to support the dermal layer and the underlying collagen scaffolding and setting up the squamous layers of the skin to support scarring either. So it's just depleting and dehydrating and degrading and depressive. And it's fear mongering that, and I think you feel this power from me because I feel really protective of people with acne, because they're sold all of these marketing gimmicks from certain companies, even like, things like Mecca and big companies that sell these quick fixes or these skincare products, when it needs to be done the other way. We need to be educating internally, and skincare is the cherry on top.
Yes, absolutely. Absolutely. But yet, so your main treatments, your main arms in your arsenal are internal, so supplements, diet modification. However, I feel like skincare can still support our skin barrier, our skin microbiome. And I'm just curious, if you're not a proponent of benzoyl peroxide, do you prescribe any skincare to your clients? And what is that skincare? Do you have any favorite ingredients?
Depends on the person's skin, because people can have dry skin and acne, oily skin and acne, combination skin and acne. I always have a double cleanser, and having a cleanser there, and I always try to make sure that they're non-comedogenic ingredients, and that the client likes them. Skincare should be fun. We're women. We should like the way it smells. Or if you don't like smells, don't use smells. Like, I really try to make that skincare the fun part for acne clients, because it's usually just another chore, and that is stressful in itself, which can spike cortisol. So I let clients take the lead on that, and I go through the ingredients lists and I let them know what I think. I do really like colloidal silver, and I do like to prescribe colloidal silver as a spray, just as like a hydration and to help with any excess of that P. acnes bacteria externally. But I know that internal cause is contributing to that over excess, because we have that throughout our whole body, but there seems to be an excess of it. So why is that? What's the driver of that? I get clients to spray their face with the colloidal silver, make sure that they double cleanse, and make sure that they're using a lightweight moisturizer that's still leaving the skin refreshed. Try not to lather up the skin. I think we need to let our skin breathe as well. Yeah. Yeah, but I do, in Australia, there is a brand called Dermavigils, and I have been playing around with a few of their products. And the reason why I don't promote any brand, I've had many brands send me products and things like that, but there's two brands in Australia, Dermavigils, and they individually create skincare for their acne clients, and they use actives and herbal medicine within those skincare formulations. And there's another company called The Secret Skincare, The Secret, and they do it the same. They're formulated by doctors, so they use more of the actives and things like that I kind of play around with, but I tend to stay clear of, just because there's so much happening in someone's body that has acne, and we don't want to cause any more inflammation, or we just, actives, I just think, have a time and place within the treatment plan of a client's journey. I love a good hyaluronic acid. Is that good?
Yes, I can see that you're not as enthusiastic about skincare as some dermatologists are, and neither am I. Some people ask me, why don't we put like product rankings and product reviews on My Healthy Skin and our YouTube channel and our website? Because My Healthy Skin wasn't set up around skincare. We promote lifestyle changes. Again, changes in your diet, changes in your stress, stress alleviation, working on your sleep, on your gut microbiome. And skincare is an afterthought, is one of these group of treatments. Is not the overarching treatment. It's funny because for many dermatologists, skincare is the holy grail. It's kind of the central part of their prescription. And it's funny how narrow that approach is when you understand the bigger landscape. Mm-hmm. So related to that, one of my last questions is on another popular treatment that you've gone through, isotretinoin. I am personally curious because I am about to go on isotretinoin, and I attended the World Dermatology Conference in Singapore in July, and isotretinoin was the most universally loved treatment for acne, whereas when it comes to other treatments like benzoyl peroxide and salicylic acid, dermatologists expressed their kind of concerns, and yes, there are side effects and reservations. Isotretinoin was universally promoted as the best treatment for acne, no side effects, just absolutely perfect, suitable for everyone. But when you go to acne communities, patients that are thinking about isotretinoin or have gone through it, they report side effects when it comes to depression and others, and just reservations and doubts. So what is your opinion as a professional and as someone that has gone through the experience of isotretinoin?
Just say with the salicylic acid, I was having a conversation with someone the other day. Salicylic acid doesn't control sebum production. Excess testosterone and androgens control sebum production. So I just want to clarify that. But this is a big topic, and I would say there is a massive long list of side effects when you open the box of Roaccutane or isotretinoid, and I would say read that and really do your research and ask questions to other acne patients in regards to their experience with it. This is my personal experience. I drank alcohol when I was younger, but I haven't drank alcohol in like 10 years, and I don't drink alcohol. And I stopped drinking alcohol because I knew that Roaccutane severely affected my liver enzymes. And my my liver enzymes skyrocketed when I went on Roaccutane. To my AST, my ALT were like as if I was someone that I was drinking alcohol all the time. And that didn't sit well with me. Not to mention, I live in Australia. I love the beach. It makes me so happy. And no matter how much sunscreen I could lather on my face, because chemical sunscreen, even like not even a physical, and hats and things, I was getting severely burnt and ending up in pain at night from having to ice my face. So I missed out on a lot of like fun lifestyle things that I could do with my partner and my family because of that, that maybe dermatologists aren't considering, and not to mention the high liver enzymes. And, you know, a lot of women really need to take it seriously and really take into consideration contraception, and be educated around that if they're using these types of heavy medications as well. So it is a very, very strong and powerful medication, and it just doesn't treat the cause of acne. It may provide results for a little bit, but if someone's cause of acne is their gut health and the excess estrogen that their body isn't able to process, Roaccutane isn't going to treat that. So from a professional point of view, and back on the personal, I suffered with severe mental health challenges that I thought was just me. When I was studying at uni, my mum was going through cancer then. I had a lot of things that I was doing as well as studying to become a naturopath and on Roaccutane. And I developed like obsessive compulsive, became very structured and snappy and very different, that I wasn't until my friends kind of told me, and then I realized how different I was. So there's that obsessive mental health component that I think is not talked about enough in regards to Roaccutane. And yeah, professionally, you know, making sure alcohol, like those liver enzymes need to be checked. They, you know, what is that doing to the rest of the body in regards to detoxification? What other side effects are happening in regards to mental health? Is it actually treating the cause of my acne? How long have I been told to go on it? Am I committed to stay on it for that long? I was told to go on it for a year. I committed to staying on it for 1 whole year, and my acne got better for 4 months, and then it came back. A lot of people go on it and then they stop, and then they go, you know, I committed wholeheartedly to it. So I think you just have to look at the thought process. If you're willing to commit to something like that for a year, why aren't you willing to commit to treating your acne internally for 6 months, you know?
Yes, absolutely. And I feel like, you know, that's food for thought for dermatologists. I just wish that dermatologists would you know, really work with the patient on a longer time horizon, not just, you know, ad hoc visits, 20 minutes once every 6 months, that are clearly not enough to inform the patient of all of these possible side effects. And I also wish that dermatologists would collaborate with their colleagues and wouldn't silo themselves into their practice, and would, you know, consider other organ systems and the patient as a whole when they approach treatment.
I think dermatologists are great in regards to skin cancers, you know, like really looking at the scarring and all those types of things, that, you know, the needling and all those types of external. But in regards to acne, active acne, that is an internal health problem. And you can, you know, look at any of my clients and go through their blood test results. See, as naturopaths, we look at functional pathology. We look at the function of someone. I look at their liver enzymes, and if it's on a high ratio to being abnormal, that is abnormal for me. I don't wait until those reference ranges have been extended and that client's liver enzymes is in a problem state, or as a doctor or dermatologist that indicates disease. I want to prevent disease. I don't want my clients' liver enzymes to be elevated, and they don't either, but Roaccutane does, and that's been proven that it does increase high liver enzymes, mental health, tetragenic side effects if women are pregnant, these types of things. So that's some pretty massive side effects for a drug that doesn't treat the internal causes of acne. And it would be hard for another professional to understand that because they're not trained the way I have been trained, and from the professors and the mentors and the PhD students that have studied natural medicine, that I come from a science and I come from an art, and the two together is naturopathy. We're not just science. If we were all science, then we would be walking that biological path as well.
Right, yes. And that just highlights again that unfortunately, acne is just so complex. It's such a complex condition that there aren't any easy solutions. No overnight, no simple fixes. And, if you are someone with acne and you want to get results that are truly long term, that exclude flare ups in the future, you just have to understand that you have to commit to changing a few habits in your life, to commit to go through the journey with a professional over 6 months, and to truly follow the recommendations if you want to get to clear skin.
And not only that, but to listen to your body, to listen to what your body is telling you. If I stopped and listened to the diarrhea that I was giving myself after eating dairy, not knowing that dairy was leading to acne and other gut health issues, I was going from diarrhea to constipation. I just thought that was naturally how bowel motions work, which is terrible that I thought that, but I didn't know any different. So you don't know any different if you don't know. So become better at, and I know people just want, well, tell me what I need to do. What do I need to eat? What nutrients do I need to take? What supplements do I need to take? And that's why I can't tell you, because I don't know you and I don't know what you're doing and where your head is at and what you've tried and how your hormones are and your bowel motions and what keeps you up at night and how many hours are you sleeping and blah, blah, blah. If you could do anything, then listen to your body and become really good at journaling and seeing patterns and understanding what your body is telling you, because like you get a cut, your body heals, and your body is so powerful you can heal your acne. There's nothing wrong with you. You just need to have the step-by-step strategy and to understand what your body is telling you. The acne face map is a fantastic tool to look at and to start with. And there's massive amounts of hope out there for anybody who's listening, and I say that very passionately because I've been sitting in the shoes where you've been sitting in, and if somebody told me that, then that had been where I had been, then I would feel confident that you will treat your acne. It's just the step-by-step to get there that needs to be worked on.
Yes, absolutely. Well, what an inspiration, Haley. I think you've given me and our audience a new dose of inspiration and motivation to, to give a second look at our lifestyle and just to get committed again, because I feel like when you have acne over a longer period of time, it's really easy to lose your motivation, to kind of give up. And having you encourage us today, it really matters a lot to us. Thank you so much.
Thank you for listening, and I invite you to check out my Instagram. Let me know what resonated with you from this episode. And if you have any questions, you can find me at skincare_academy_. And I'm really looking forward to chatting with you, meeting you, and I hope you have the most amazing day, and I cannot wait to see you again.